Hello everyone, I am Dr. Cooper Dockery, and I'm delighted that you took time to join us on our program today. Get Healthy with Dr. Cooper is a program designed to give you, the viewer, evidence-based information on healthy lifestyle habits which are important to prevent, improve, or even reverse chronic diseases such as diabetes, heart disease, hypertension, and even some cancers, just to name a few. Are you one of those people confused about what to eat? Have you heard that carbohydrates might be bad for you or good for you, and that too much protein might be good or bad for your health? Are you confused? Are you in search of real answers? Then stand by as Get Healthy with Dr. Cooper starts now. Welcome again to Get Healthy. Our topic today is eating your way to good health. Did you know that most people are more comfortable about what kind of fuel they put in their cars than the kind of fuel they put in their bodies? Most diseases that we suffer from are actual symptoms of eating the wrong foods. There are many studies today to support this statement. And if you stay tuned to Get Healthy with Dr. Cooper, you will learn how to eat the right foods in combination with some simple lifestyle habits which will aid you along your quest for living a longer and happier life.
Many diseases and poor health conditions that we suffer come as a result of not taking good care of our body. Dr. Donna Cooper Dockery is a certified internist that will take care of your health. Are you suffering from diabetes, obesity, high blood pressure, sleep apnea, chronic pain, or any other disease? Trust your health in the hands of Dr. Donna Cooper Dockery. She and her great medical team will take care of you. Call today for an appointment. She is waiting for you.
What are your options if your doctor prescribes an x-ray, an ultrasound, or a vascular exam? Do you want to go there? To find parking in that? Just to deal with this? Well, you don't have to. Rio Grande Valley Mobile X-Rays comes to you. Just call 1-888-783-9779. It's that easy. So if you need an X-ray, ultrasound, EKG, or 2D echo with no waiting, no parking, and without leaving your home, call Rio Grande Valley Mobile X-Rays.
In our headlines today, just about 2 minutes from now, scientists have concluded that the consumption of fruits and vegetables may reduce mortality and death. They have also concluded that an increased intake of fruits and vegetables may also reduce the risk of some chronic diseases such as coronary artery disease and colon cancer. In the Nurses' Health Study showing the effect of fruits and vegetable intake on coronary artery disease, 84,251 women ages 34 to 59 were followed for 14 years, and 42,158 men ages 40 to 75 were followed for 8 years. All of the participants were free of diagnosis of coronary artery disease, cancer, and diabetes at baseline. The main outcome measured were fatal myocardial infarction and fatal coronary heart disease. Diet was assessed by using food frequency questionnaires. At the conclusion of the study, researchers confirmed that the consumption of fruits and vegetables, particularly green leafy vegetables, and vitamin C-rich fruits and vegetables appear to have protective effect against coronary artery disease, and that patients that consume these fruits and vegetables decrease their risk by 4%. Given this positive ongoing research showing that there is indeed better outcome of all diseases in patients that have embraced a plant-based diet as well as other healthy lifestyle habits, there is a surge in wellness and lifestyle industries in the United States and in other parts of the world. This is Dr. Cooper Dockery, and that's our health news for today. Stay tuned for more exciting information when Get Healthy returns.
Some risks are obviously not worth taking.
Watch where you're going!
Some aren't as obvious, but could be just as deadly, like the risk for type 2 diabetes, especially if you're over 45 or overweight. Take the diabetes risk test. It's free and takes less than a minute. Type 2 diabetes is one risk you can't afford to take. So stop diabetes before it stops you.
Living in a healthy way is now possible. Learn how with Dr. Donna Cooper in her TV show, Get Healthy, where we will address various topics like eating, exercising, and other preventive health tips.
Hello, I'm Dr. Cooper Dockery, and together we will learn how to live a longer and healthier life. Don't miss it!
Get Healthy with Dr. Cooper, every Sunday at 10:30 a.m. on KGBT Channel 4.
Welcome back to Get Healthy. And today in our studio we have Dr. William Santana. Welcome, Dr. Santana.
Thank you. Thank you,
Can
Dr.
you tell
Cooper.
us something about yourself?
Well, currently I work for South Texas College. I'm directing a bachelor program there in Medical and Health Services Management. I have also been a professor at Pan Am University.
Very
Now
good.
the Rio Grande Valley University, UT.
Very good, very
right.
good. And you hold a doctorate degree in preventive medicine, am I right?
Well, the doctoral degree is in public health
Public health.
with emphasis in preventive medicine.
Very good. And you now teach at Pan Am on nutrition.
I teach one class there, an introductory course to nutrition for candidates to the nursing program.
Very good. So today our topic is eating your way to good health. Is that possible?
It is possible, and we have seen it. There's plenty of evidence, there are plenty of studies that show that proper eating can lead to a long, productive, and healthy life.
Very good. What would you define as a healthy diet?
Well, it's a diet that's well balanced, that provides the nutrients that the body needs, that does not provide excess calories and excessive nutrients. Good balance, particularly in the area of fruits, vegetables, grains, nuts, etc.
Very good. Now, people always say that carbohydrates are bad for you. What would you say about that? What are good carbs and how much should we eat in our diet?
Well, this is not true. Carbohydrates are not harmful to anyone. The problem with carbohydrates has always been the excessive intake of them, which lead to a number of diseases, among them cardiovascular disease, diabetes, obesity, and other diseases that come as a result, as a consequence of overeating carbohydrates.
So what percentage of our diet should be composed of carbohydrates then?
Well, what is recommended by nutritional professors and authorities is that 45 to 55% of our diet should be carbohydrates.
Very good. And then tell us, what carbs would you say are the good ones that we should eat, or do we have bad carbs?
Well, you know, there are good carbs and there are carbs that are not so good. Particularly the simple carbohydrates, the simple sugars, can be very harmful because they are absorbed so quickly into the bloodstream, which cause high spikes in blood sugar, and which are really not good for us, especially if you are pre-diabetic or diabetic.
Very good. So therefore, the carbohydrates like white flour, white bread, white rice, these are things that we should avoid. Am I right?
Well, we should certainly reduce greatly the amount because, you know, a certain amount of that is okay as long as you maintain a better balance with the more healthy carbohydrates, the more complex carbohydrates.
Very good. Let's talk a little bit about fruits and vegetables. Are these good carbs?
These are good carbs. Again, always maintaining being aware of excess. But if we eat them in appropriate amounts, fruits and vegetables really are the best carbohydrates to be consuming.
Very good. Now in the Valley, we have a lot of people who are overweight. We have a lot of diabetics. what would you advise them to eat? You can tell our public.
Well, you know, we do have a real problem with obesity here in the Valley, and Hispanics have a strong tendency towards diabetes, and so it's very important for everyone to be aware that there are carbohydrates that can lessen the impact of diabetes if we choose them right. There are some carbohydrates that are very, very quickly absorbed into the bloodstream and therefore raise the blood sugar. And then there are other carbohydrates that are more complex. You have more fiber present there. They are absorbed a lot slower, and therefore it gives the bloodstream a chance to propagate all of these sugars evenly throughout the body so that you do not have these problems with high blood sugar.
Very good. So then green leafy fruits and vegetables are what you would advise. Am I right?
Well, yes. Green leafy vegetables, grains are also very wholesome. They're complex. It takes longer for them to be broken down and absorbed into the bloodstream. So, you know, a greater portion of these should be a part of your carbohydrate intake, of that 45 to 55%,
Very good.
which I have mentioned.
I can see you have a lot to tell us. We're going to have you come back. So at this time, I want to say thank you so much for coming and for enlightening our public with such important information. Thank you. We'll be right back. Don't go away.
Well, it's going to be a beautiful sunny day today, and we can expect much more of the same over the next few days.
Motorcycles are not invisible. But they can seem that way to drivers who aren't paying close attention. Look twice for motorcycles. Seeing them is saving them.
What are your options if your doctor prescribes an X-ray, an ultrasound, or a vascular exam? Do you want to go there? To find parking in that? Just to deal with this? Well, you don't have to. Rio Grande Valley Mobile X-Rays comes to you. Just call 1-888-783-9779. It's that easy. So if you need an X-ray, ultrasound, EKG, or 2D echo with no waiting, no parking, and without leaving your home, call Rio Grande Valley Mobile X-Rays.
Welcome back to our program, Get Healthy. Today we have been speaking about healthy nutrition, but for us to be healthy, we must combine good exercise with nutrition. And at this time, we are going to join Rebecca and Christopher in our section on living active.
Thank you, Dr. Cooper. This is Living Active. My name is Rebecca Huerta.
And I'm Christopher Hanna.
And we're going to be demonstrating a full body workout that you can do in the comfort of your own home to start off your day. The first 3 exercises that we're going to demonstrate are going to be part of a circuit. You will repeat each exercise for as many times as you can for 30 seconds on and 30 seconds off. What that means is you will repeat each exercise for as many times as you can for 30 seconds, followed by a 30-second rest. Now, the first exercise we're going to demonstrate is called a burpee jack. Christopher's going to go ahead and demonstrate it for you. What it is that it's a combination of a burpee and a jumping jack. You'll go ahead and go down into a push-up-like position, kick your legs back, keep your back straight, go ahead and go into a jumping jack. You repeat this for as many times as you can for 30 seconds, followed by a 30-second rest. Now, if you feel that you can go ahead and keep on moving after you have completed those 30 seconds, you will do an active rest. An active rest will allow you to keep your heart rate up, burn extra calories. The second exercise we're going to go ahead and demonstrate is going to be high knees. You will do the exact same thing. You will repeat for 5 rounds, 30 seconds on and 30 seconds off. High knees, the main muscle work is your core, but of course you're engaging your knees as well, your legs too. You're going to repeat this for 30 seconds on and 30 seconds off. If you want to have an active rest, go ahead and keep jogging, Keep your hands moving so you can burn those extra calories. The third exercise that we're gonna do that's part of the circuit is going to be mountain climbers. You're gonna go ahead and go down into a push-up-like position and bring your knees to your chest. You will repeat this for 30 seconds as well with the 30-second rest. This will be a 15-minute full body workout that you can do to get your day started. Now, after you have completed those 15 minutes, you will do 2 more exercises. The first exercise that we're gonna do is going to be bicycles. You're gonna go ahead and lay down, and you're gonna bring your knee up, both of your knees, and you're gonna wanna bring your elbow to each knee. You will wanna do this for 3 sets of 30. And you're gonna go ahead and maybe have like 20 to 30 second rest in between each set. The last exercise that we're gonna go ahead and demonstrate is going to be mountain climbers. Now the main muscle work here is also your core, but of course you're also engaging the rest of your body, such as your arms and your legs. You're gonna go ahead and go down into a push-up-like position, and you're gonna go ahead and bring your knees to your chest. You're gonna repeat this for 30 seconds, and then you're gonna have a 20-second rest. Thank you, Dr. Cooper. This is Living Active. My name is Rebecca Huerta, and this is Christopher Hanna. Now back to Dr. Cooper in the studio.
Thank you so much, Rebecca, for that interesting routine you gave us today. And remember, 30 minutes of exercise a day will prolong your life for 60 minutes. Don't go away. We're going to take a short break when Get Healthy returns.
Vicky couldn't wait to share her feelings with John. So she hit a pedestrian. Texting while driving can be as dangerous as drinking and driving. Put your phone away.
Many diseases and poor health conditions that we suffer come as a result of not taking good care of our body. Dr. Donna Cooper Dockery is a certified internist that will take care of your health. Are you suffering from diabetes, obesity, high blood pressure, sleep apnea, chronic pain, or any other disease? Trust your health in the hands of Dr. Donna Cooper Dockery. She and her great medical